Hi, I'm Kate Yoon. I'm a pediatrician in Philadelphia, where I work for the Children's Hospital of Philadelphia. I work in our South Philadelphia office, and I'm really pleased to be here with you today. Thanks so much for having us.
Hi, I am Coralie del Valle Mojica. I am also a pediatrician specializing in infectious disease at the Children's Hospital of Philadelphia, where I've been for 2 years, and happy to be with all of you today.
I mean, I would say on a personal note, the biggest change for me was when we had to, you know, stop sending my child to school. And that was so difficult, both, for my child, because they just really thrive in seeing their friends and having those social interactions. And I'm not a teacher. I don't have all of the ideas and the skills and all the great, teaching ideas. And so that was really hard. And then of course, professionally, that made things a little challenging. And then I would say professionally, I think the hardest thing has been, I mean, it's been really heavy for families. We have families who they were scared. They knew at the start of the pandemic, they knew coronavirus was going around, but they couldn't stop going to work because they didn't have another economic option, or they were hourly and they were worried they were going to lose their jobs. And it was a time when they didn't have enough protections at work. And so at the same time, people were getting sick. And I think that's professionally, it was really hard to see that happening around me, for people who I know. And then also to see people who made the decision to stop working and seeing how that was hard on their families economically.
I moved here to Philadelphia less than 2 years ago with one of the hopes being, traveling more often to go home and see them and spend some time with them. And not being able to do that from the get-go was really hard. The last time I had been there was right before the pandemic hit in February, and I was able to go back more than a year later, last month, after I got my vaccine and was cleared and felt safe. It was okay to do so. Not only me being vaccinated, but also my parents and my family members. From a professional perspective, I think the most challenging piece has been seeing how on a day-to-day basis, like the Latino community and Hispanic families are still uninformed, and they don't have all of the pieces of information that they should to make an informed decision and really feel safe and be vaccinated and be able to move forward with their lives and back to their new normal. So really empowering families with information in their preferred language has been a priority, and very, very pleased to do that on a day-to-day.
It has just made such a huge difference when people can get their vaccines, because I work with a lot of families who, you know, they have to do in-person work. And so to have that extra feeling that you're protected, and especially because, I'm working with families who have children, because I'm a pediatrician. And so to know that they're not going to get sick at work, they have that extra protection from the vaccine, and then they're not going to get their kids sick, I think for a lot of people has been really important. And I think it's also helped people to see how well things have been going for some of the folks who were kind of early on in getting vaccinations. We were very early on in getting our vaccines because we were working directly with people who have coronavirus, and I didn't want to get my family sick either. And so I think that's also helped, just being really upfront about the fact that, yeah, I got my vaccine, I got it to protect my family, I got it so I could feel like I could come home and be safe when I came home. And also, like Coralie said, to feel like I could go see, the elders in my family. that was a hard thing for that period of time when we were so afraid that we would harm them by seeing them, when all you want to do during times of hardship is like wrap your arms around your family. So I think all those things have helped a lot of people, and being really honest about, you might get a fever. I had a fever, but I don't have a fever now, and I don't have coronavirus now either, and I'm feeling great.
So I think Kate touched on, the one important point, which was clarity and making sure that that family, that individual had the right information on hand.
What I've been really candid about is I have friends and family all over the world, and I know folks in countries where there isn't enough access to vaccination, but schools are open and kids are getting sick, and it's enormously disruptive because even though most kids feel, you know, okay, which I think is a blessing, there are still some kids who do get really sick, and it's really hard to have coronavirus go through your classroom. So to me, I think the vaccine is a smart choice for school in the fall. I really think it's going to make school a better experience and make it easier, for kids to get back to the things they want to do with their friends. Um, and the other thing is, we have to remember that not everyone has a working immune system, and not everyone, you can't tell by looking at someone. Like, you might not know who in your class actually needs you to protect them, or you might not know which person who works at the school needs you to protect them. So I also think we have a responsibility to each other.
I mean, I'll start by saying, there is the difference between a vaccinated individual and somebody that, hasn't had the chance to get the vaccine or has elected not to. For somebody that has had the vaccine, for both mRNA vaccines, after receiving 2 doses, 14 days after the second dose, you are considered protected. And for those individuals, the CDC has put out guidance on, you are allowed to resume your normal activities when you are out and about. That obviously excludes certain settings, like, for example, hospitals. We are still required to wear a mask on a day-to-day basis with our patient encounters in clinic, in the hospital, etc. And that may also be the case for certain employers or, certain areas where there is still a mandate to wear the vaccine. However, if you're, vaccinated and you're out and about, then, you have the pleasure of not having to wear the vaccine, of really taking in some sun, really seeing people's facial expressions, which I so much miss. And I think to the question of, how do we approach the topic of, do you have the vaccine or not? That is really tricky. And I don't know that I've thought about this myself, but just throwing something out there, one thought could be volunteering to share your vaccination status. Maybe that opens up a conversation of, maybe that other person wants to share that they did get it or that they didn't get it. Both for you to, continue social distancing or continue wearing your mask to protect that individual if they haven't gotten the vaccine, and also as an opportunity to share your experience when you got the vaccine, if there is the opportunity to do so. So I don't know, Kate, have you encountered that already?
Yeah, it's a pretty recent change, and so I think we're all getting used to it and trying to figure out what it means for us. What I've done, what my family does, is we still carry our masks. We absolutely have them with us. And then, I've been exactly that, volunteering my status. So I'll say, oh, I'm vaccinated, but I'm happy to wear a mask. Because I also, some people are still getting used to this idea. And so I think, we're trying to be polite and make sure people feel comfortable. And I still really have to adjust. It's such a big change, and especially because in healthcare, our masks before we had the vaccine that really protected us. So it's hard to make the transition.
So there are no strict medication contraindications for receiving the vaccine, or really medical conditions that you would prevent you from getting the vaccine. Actually, the contrary, if you have a medical condition, it is encouraged that you do, because you likely carry a higher risk of being hospitalized, developing severe disease, or even death from acute COVID-19. In terms of contraindications to receiving the COVID-19 vaccines, there is a particular product that is commonly seen in laxatives or medication used for constipation. And I'm not going to say the long word. Maybe, Kate, you want to try, but the short of it is PEG. And you can see it sometimes in products like Miralax that are used for constipation. So if your child has had a anaphylactic reaction, which means a quick reaction of swelling of the face, swelling of the lips, vomiting or difficulty breathing right after that type of product, then that is a contraindication to receiving COVID-19 vaccine, because it does have a little bit of that product in its manufacturing process. Other than that, you're good to get the vaccine.
Yeah, it's exactly like Coralie says, in terms of wanting actually to prioritize vaccination for children who have chronic health conditions. And a question we often get is it okay to take a medication like acetaminophen or ibuprofen if there's, for example, a fever or a sore arm after the vaccine? And we know it's absolutely fine. They actually included that information in the clinical studies. And so we know a lot of the people in the clinical studies where they researched how well the vaccines work took those medicines, and the vaccines, worked.
Nothing acute after the vaccine that I would be concerned of that necessarily brings somebody back into medical care. I would like to speak a little bit about MISC, which some of parents may have heard of, because it stands for multi-system inflammatory syndrome in children. And it is a condition that particularly affects the pediatric population, where somebody that has had acute COVID has this post-infectious inflammatory syndrome that tends to happen about a month or so after the infection. So if your child has, symptoms of persistent fever for 2-3 days with vomiting, diarrhea, nausea, perhaps that accompanied by a rash, on the body in any site, that warrants medical attention and a call to your pediatrician to say, hey, my child had COVID a little while ago, now has these symptoms. Should I go to the emergency department? The answer is likely yes. But in terms of after the vaccine itself, Kate, have you seen or counsel about anything specific?
No, I think your point about severe allergic reactions is a really good one. folks should be monitored long enough that the risk of a severe allergic reaction would have passed by the time they go home because of that 15 to 30-minute monitoring period. But certainly if your child were to develop signs of a severe allergic reaction, anaphylaxis with swollen mouth, inability to swallow, inability to breathe, anything like that, you would need to seek care. But that's extremely, extremely, extremely rare. And I volunteered for a lot of vaccine clinics, and we didn't have anyone who had any of those reactions during my time volunteering. And then just to really emphasize that MIS-C is not seen after the vaccination. So it's another good reason to vaccinate, because it does not have to happen after vaccination, and vaccination can prevent, that which is one of the potential long-term severe consequences of a coronavirus infection in a child.
And one last thing that I forgot, I should add, out of transparency, and you may be seeing this sort of very common topic in the news. After children started getting vaccinations, there has been reports of something called myocarditis or pericarditis, which just means inflammation of the heart muscle or inflammation of the covering of the heart. There has been reports of that after COVID vaccine in children. However, the CDC and the American Academy of Pediatrics have looked at those unique cases and have determined that still the benefits of vaccination outweigh these potential risk of the few individuals that have developed this. This is an ongoing thing that we're looking at on a day-to-day basis to try to determine if there's any association between vaccine and then developing these. And you may hear more about this, so I just wanted to make sure you knew.
Yeah, and I would emphasize that these vaccines are being really rigorously monitored. The reason why we know about such rare events like myocarditis is because of that really close monitoring. And I do think there's been a lot of transparency. And so the reason we know to caution people about potential allergic reactions, even though they're extremely rare, and monitor, even though they're extremely rare, is because there was very close monitoring when the vaccines rolled out in December. There were a few cases, and those were reported almost immediately. I think the first public reports came out with information from the CDC, with information with a full investigation. Gosh, was it in early January or mid-January by the time we had started to see the official public reports? And so there's really close monitoring. And I do think there's been transparency and honesty in letting the public know when there is potentially, anything that they should be aware of. So specifically about the younger children, I think because so many early childcare centers have been open, many started opening in June or so of last year. Some even remained open for children of certain essential workers through the entire pandemic. And so we really know their infection control protocols work. And the things that have been helping are having the vaccine available to staff, because when staff stay healthy, kids stay healthy. Having people follow basic precautions at school. And so, for example, kids will mix inside their classroom, but they might not mix with another classroom. And that way, if by some bad luck there is a child with coronavirus in one classroom, you're not shutting down the whole school. You're not worried about all of those kids. You're really restricting the potential exposures. And then also, again, we've talked so much about how this is a community effort. It does mean parents have to be more cautious about keeping kids home if they might be sick or if someone in the household is sick. But we're in a totally different world from, this time last year, where if you wanted to get a test, it was like, call everyone you know's mom. It was almost impossible. Now it is really easy to get children a coronavirus test. And so if there's any doubt that a child who's attending school might have an illness where they need to be tested for coronavirus, or that a household member might have an illness where they need to be tested for coronavirus, just go get the test. They're easy to get now. They're coming back quickly, because it really will make all the difference to keep schools working the way we know they can work based on what's been happening in the schools that have been open. for almost a year now.
And then the second part to that is, staying in touch, with your pediatrician, with whomever you trust for information, because there are current pediatric clinical trials in younger than 12 years of age. I think I heard that there was a little baby, 8 months old, that got the vaccine recently. I have to double check that. But there are current pediatric clinical trials, and we may soon have vaccine for even younger than 12. So staying involved, staying open to that information to get it when they can.
Yeah, and I know parents are worried about schools, but the schools can make it work. Many schools have been doing it. It's a team effort. And then again, by staying in touch with your pediatrician, by finding out if vaccine opportunities open up for younger children, it's going to get, safer and easier over time as well. There's already that protection for young people 12 and older, which is amazing.